Hey guys, welcome to the CPD Junkie Podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Launceston, and today we are joined by Dr. Bing-wei Lee. Dr. Bing Lee graduated and grew up in Singapore before embarking on his dental degree at UQ, graduating in 2013. He started a dental practice from scratch in 2015 in Launceston, Tasmania, and grew it to a 10-chair practice with 10 clinicians in 5 years. He practices a wide range of procedures and has a passion for surgical and reconstructive dentistry, with a particular interest and emphasis on utilizing innovative digital technologies to provide superior outcomes for patients. He's also passionate about mentoring, having taught in multiple courses Australia-wide and engaging in mentoring programs with the new and recent graduates in his practice. Dr. Bing-wei Lee, welcome to the show.
Hi, thank you for having me.
So, your passion is surgical and reconstructive dentistry with an emphasis on innovative digital technologies. Tell us about how your CPD or dental journey kind of helped develop that.
Man, I think I sort of fell into that. When I graduated, I actually joined a practice that had a rate cam. So it was the very, very early CEREC machine. And that, I guess, opened my eyes to the possibilities of digital technologies. And it's just sort of grown from there. So I've done a whole heap of CE based around that. And I think at the way it is going now, there aren't actually a lot of CE that teaches you the really, really cutting edge stuff. So that we've sort of had to sort of come up with ourselves, which is great.
I mean, tell us about that. So you kind of fell into it, you said. Was it that, were you looking for a practice that had this particular digital dentistry side of things kind of, or was it like you said, you're just kind of looking for a practice and then this is how you kind of came about it?
Well, I mean, this is how I came about getting into it because I applied for a job and they were like, we've got a CEREC. And I was like, oh, that's great. And in my head, when I came straight out of uni, I was like, oh, all CEREC's the same. All right. So I started on the job and the first day I was like looking at this machine. And I think it had like Windows XP or something, like really, really old stuff, right? So I didn't know what unit it was. And back then, DPR was just getting off the ground. And so I was like messaging a few people. I was like, what is this machine? And it turned out to be like a rate cam, a CEREC 3, which is old. And I just had to run with it. And it's a pain in the bum thing to use. But I think when you can use a rate cam, you can use anything because it's just so fiddly. Yeah.
So, look, I mean, this is the practice, what is it, Dr. Cole and Armadale, is that right?
Yes, I mean, like when I worked there, Dr. Chris Cole had just sold the practice, and so he sold it to my boss who hired me, and so Dr. Chris was working a day and a half a week, and I was basically there a lot of the times myself.
Right. So, I mean, did you have much CEREC experience back at uni?
No, zero.
Yeah, so then how does it happen that you go into a practice that's doing CEREC? I mean, there probably wasn't a lot of courses for CEREC at that time, were there?
Zero. There was a manual that I read. And can I say this, right? I think back then when I graduated, the whole Australian social media system was very, very different, right? It was just, like DPR was just started. And DPR was actually started by Sui, who worked in Armadale then as well. And so, a lot of the big names today where you need to pay to do courses with them, they will just help you out. So I was very lucky because I was there by myself and I knew that, oh my God, I needed to get some support. And so I will message someone like Lawrence, I'll message someone like Alfred Sang, who helped me a lot. And they will really just run through stuff with me, So that was great. Yeah. So I was very lucky.
Yeah. And then the other thing was at the practice, you were doing rotary? Like with the Wave 1 or something like that?
Yes. Well, I mean, they had the Wave 1 system as well, which was good. And I did a course, Omar Ikram works in and out of Tamworth, and he ran a Wave 1 course, and that's where I got I guess hands-on experience of how to use it, and he was great as well, answering questions that I had.
So basically, earlier on, you were kind of focusing more. Was it on the endo side of things, or was it more on the prod side of things?
Yes,
Would you
I mean,
say?
early on it was really about focusing on the basic stuff. So how to take teeth out. I was doing some wisdom teeth extractions. I was lucky because when I was in uni, I was very, very right. So I would, there were demonstrators in I can remember, right, in fourth year I was taking out horizontal impactions under GA, right? And so I guess that was because I knew that was something that I wanted to go into, and so I had quite a lot of experience in that by the time I graduated. And yeah, and taking teeth out, you know, rotary endo, CEREC, just basic, nothing, no rehabs, no big sort of cases when I just graduated.
Yeah, and so how did you kind of build on that wisdom surgical side of things earlier on? Did you attend any particular courses, or was it just more practice with patients?
Well, I mean, I was practicing, and then what happened was when I started my practice, I was like, man, I gotta get
A
someone.
lot better, very quickly.
That's right. And so what I did was I actually flew Sui, who is an oral surgeon now, and I flew him, myself with Emmanuel, a friend of mine who works in Melbourne. We actually flew him to Melbourne first, where he watched us take teeth out for 3 days, right? And then after that, I flew him another time to Launceston, where he came in, and my associate, my wife and myself were. My wife didn't really do many cases, but my associate and myself were just taking teeth out, and he would just watch us do it. And when we ran into trouble, he would bail us out. And he had he's got a program now, right, which is great. But back then he was building it up, and there was a lecture component on how to identify, what's risky, what's difficult, what's not difficult, like a case assessment stuff as well. And yeah, but the important thing was basically having someone there to show me, and I guess refine my techniques. Yeah, that's something that we've done, with other practitioners as well.
Sure. I mean, it's interesting that you mentioned that, when you were coming out and you started at Dr. Cole's practice, that you were mainly focusing on the CEREC, you were mainly focusing on the endo and the wisdom, because he does a lot. He talks about doing a lot of restoring OVDs, strengthening bites, improving aesthetics and all of that. So you didn't feel compelled to jump into that straight away. You wanted to do the bread and butter a little bit better first.
Well, I mean, I think to do that properly, I think there has to be, I mean, I do that now, and I feel like there needs to be a lot of foundational background knowledge that you have to build on. Otherwise, you don't I guess, I think, increasing someone's OVD is a great example. Like where do you end up, right? And I guess for me, what I wanted to do was to make sure that I could, everything that I do, right? I want to make sure that I can do it well. And so I just, I've as much as possible tried to be deliberate about what I learn. Yeah.
Right. And so talk to me about, being deliberate about what you wanted to learn, because soon after that, you were pretty much, late 2015, you opened up your own practice, and you've since been going strength with strength with strength. Tell me about, how you were kind of deciding the kind of CPD you were kind of deciding that you wanted to do. You mentioned already wisdom teeth was one aspect. Talk to me about all the other stuff that helped you tailor your way towards a reconstructive dentistry.
Well, I think in those sort of cases, right, I think it's very important to talk to people who have more experience, who have done it before. And so someone that really has shaped the way that I do things is when I was in Amado, some of them, right? And and essentially, I just sort of every year I try to identify a specific area that I want to focus on, right? And I try to sort of do things that build on each other, right? So when I spoke to Lincoln, right, he essentially told me, this was like 3-4 years ago now, right? Before I even started doing implants, he was like, you need to learn how to graft stuff first before you learn how to place implants. Back then it was like, man, placing implants, like, a graft is usually thought of as something that's a lot trickier than doing an implant.
Yeah, soft tissue wasn't really the topic. It was people just talking about bone, implants, like that's it. But now it's kind of changing a conversation.
That's right. And so when I started, right, I actually started doing, gingival grafts first, right? So I would do gingival grafts, and then, I started learning about hard tissue grafts as well as putting implants in, right? And so from the implant side of things, I probably did 6-7 courses, and these are not like short courses, right? I think I've done courses that are like modular, 3 or 4 of them, right? So I probably have spent like 100 grand on implant courses. And so I think back then what I wanted to do was just to make sure that I learned how I could handle soft tissue, I could put a graft in, and I could handle like fine suturing as well. And that served me very well, because when I started putting implants, right, like, you don't have to put an implant in a weird position, because you can then, you can graft first or graft at the time that you put the implant in. And so I guess, when you take CE, right, what you have to do is you have to think about things that are, I guess, complementary to each other. And it really helps talking to somebody that has got experience in it. And so, another year, what I wanted to learn was like, okay, I wanted to, I thought I had a pretty good grounding on occlusal concepts, done enough courses. I knew how to change someone's bite, I knew how to assess someone's bite. And I was like, okay, I want to start doing rehabs, right? So what I did was I essentially did Tony Rotondo's, I did
mini
one
residency?
and the other. I can't remember which one I did first. So Lincoln used to run a rehab mini residency, right? And I think that was the start of the year. And then Tony Rotondo ran he still runs a mini residency in Prox, right?
Yes.
So what I did was I did both in a year. I'm pretty sure now I did Lincoln's one first, so I could get a grounding on like the practical aspects of doing a rehab, right? Like how do you prep quickly? How do you temporize? How do you check someone's bite? And that was done early in the year. And then later in the year, I did Tony's mini residency, which gave me a lot of the theoretical knowledge, because in Lincoln's course, he didn't really talk a lot about theory, and in Tony's course, there wasn't really a lot of hands-on component in terms of rebuilding someone's bite. So I think that really together, really served a great foundation for me. And it was in 12 months, right? But I think in total, probably it was probably $100,000 worth of CE in a year, right?
Yeah.
Because I had to fly to Bundaberg, I had to fly to Brisbane. But it was great, because it gave me a very, very solid grounding on why we do stuff, how do you do stuff as well.
Well, let's hash back a little bit here. So, you mentioned earlier on you're kind of being very, you're trying to be mindful about what kind of courses that you're picking and tailoring it towards your interests. And so what was it earlier on that you were doing? Because you mentioned that you're doing these big courses for a new graduate. That's a common issue that they kind of feel is difficult to decide on, because one, they're stuck with a lot of student debt, right? And now you're talking about these courses that aren't cheap. These are like, you're talking modular courses that take quite a bit of money. We're talking like, 20, maybe to 30,000, maybe, like you mentioned, 100K in a year. So how would you suggest it to the graduate?
Man, don't spend a lot of money. I don't know what else. Yeah, I mean, like back then, right? My wife, my then, I guess, girlfriend, right? Now my wife, we didn't do much, and I think you just gotta put in like hard yards, and there's no either you join a practice where your boss sort of does this sort of stuff and they can, I guess, help you with that, or you have to learn it yourself. And I guess for me, right, it was a choice that I decided to take. And my wife, and now wife, right, is always complaining that, oh my God, you're spending so much money on CE, which is a problem. But it's served us very well, because you always just want to be a better dentist.
Yeah. So I guess what you're trying to say is that, yes, look, you might be stuck in a bit of debt. I mean, obviously you still have to consider your own situation, but first off, you might just do the simple courses first, and then just kind of, once you've got a kind of a steady kind of income that can kind of supplement it, that's kind of when you want to commit to it early. Don't try to hold back for too long, because the earlier you kind of commit to it, the better it is. Is that what you're trying to say?
Well, I mean, yes and no. The thing is that, in my first, this is like a 5-6 year thing, right? And the first couple of years, I don't think I took that much CE. It was just about basically learning the simple stuff. I wasn't doing any implants, when I was at Armadale. I wasn't doing any implants in Launceston until maybe 2-3 years ago, right? And I mean, I don't want your listeners to sort of feel like that they have to basically eat instant noodles for a year and put all their money to CE. Nothing like that. I feel like, there is a time and space for that sort of stuff. And if over 5 years, right, if you're very deliberate about what you're learning every year, then you can get the best sort of bang for buck and get the best outcomes.
Talk to me about that, because it's interesting you mentioned, be deliberate about the kind of things you want to learn. Because some people, graduates come out, they've got, I need to do ortho, I need to do implants, like I got to learn everything really quickly, I need to do wisdom teeth really quickly, There's so many different things that are just being thrown at them, and they feel like they need to learn it straight away. They want to, but you're saying, look, slow down for a second, just focus on one thing. And be sure that you want to learn that, and then just focus in on that first before jumping into trying to learn maybe 2 or 3 things at the same time.
Yeah, I think there are things that sort of blend into each other, like surgery, sort of, they're quite similar concepts when you look at different things. But a great example is ortho, right? Like I was one of those guys that I was like, shit, I need to learn ortho implants and this of everything, right? And so I did a 2-year mini residency. Back then it was 2 years, and I didn't start any cases because I just was so, at the end of the day, I just had to decide what I wanted to get better at first, and I just couldn't juggle all that. I just couldn't juggle. Actually, also I did it quite early. I actually did it. I actually started ortho in my first year out. And only recently did I start picked up ortho again, right? But I think, that's a great example. That is probably another, another bunch of money that was lost. So I think, you need to figure out what you want to do. I think you need to figure out what you like. It's hard, but if you don't want to throw money down the drain, I feel like you need to spend at least a couple of years just getting your basics right. And I probably didn't do it the right way. I probably didn't do it the way that I would do it today. And I feel like, I surprise myself sometimes, like thinking about, how much I've learned over the years, and yet making so many dumb mistakes in terms of choosing CE, you know? Yeah.
Yeah, I mean, look, thank you for being so open about that, because, a lot of people don't mention these, you spend a lot of money on a structured course, which I guess your mindset was, I didn't want to spend weekend courses learning about ortho. I wanted something solid, structured, that's going to give me a format. And then even after going through that, you felt, look, hey, I didn't feel like I had that support network. I didn't feel comfortable learning about it. And so, I didn't want to do it. And then I would rehash that on that again later when you're more comfortable with it or wanted to explore it a little bit more.
I feel like, I just want to clarify, right? I don't think it's about the structure of the course. I think it's more me. I think it's more me having that mental bandwidth, to back then I was looking to start a practice. I was building it. I was stressing over, oh my God, is it going to fail? Is it going to work? And trying to, keep up with the clinical stuff as well. And still, I was still quite a recent graduate. I was still, learning stuff myself. And I knew that, once I started my practice, right, you live or die by things working, right? There was that part of it. And I guess, ortho, there is a lot of learning in ortho, right? It's like you doing surgery. I think a good way of looking at it is to decide whether you want to go down, I think pros and ortho and implant/surgery, they're quite distinct sort of fields. And I feel like almost you have to pick one. Pros is a bit easier because you've got a good grounding of it in uni. Surgery, depending on which uni you went to, depending on how much surgical experience you had, you might or might not get that sort of level of grounding. And also, I think, I don't think anyone in Australia has a good grounding in ortho straight out of uni. So yeah, I think you just got to choose, right? You just got to pick, and then there's endo as well, right? And then there's like other stuff like peds, other stuff that you gotta learn how to do, like dentures, that you need to learn how to do if you are starting your own practice and if you are looking to get better at everything as a dentist a couple of years out.
So how did you decide, that, look, I'm going through this ortho course, but actually I realized I don't actually really like it all that much. I kind of like the surgical side of things a bit more.
Not well, obviously, right? Because if I did it well, I wouldn't have chosen ortho straight out and not did any ortho cases. I don't know. I just think it depends on what, really, I think it depends on what sort of falls in your lap. And I think it depends on, it's weird sometimes, all it takes is somebody to talk to you about something, and then you do that course and you just start going on a different path. And I think that's what happened. I think, I am, close to somebody like Andrew Thorpe. I was close to somebody like Lawrence, and they sort of shaped me, and Tony Rotondo as well. Done so many of his courses, and these are the people that I guess have shaped me and have sort of inspired me inspired me in doing certain things, right? And doing things a certain way as well.
Sure. So, I mean, you've reached this point. You've decided to do your practice, but for a lot of graduates, around that 4 or 5 year mark, they start to think about, hey, do I want to be a practice owner? Do I want to specialize? Do I want to become a super dental GP? Or do I kind of want to focus on a bit more family? How did you kind of decide how you wanted to go?
And there is no easy way of doing this. I feel like I made the choice very, very early. And I'm happy about it, right? But starting a practice, I'll just talk about practice ownership first, right?
Sure.
I feel like, starting a practice to many dentists seems almost like a rite of passage that you have to do, right? But I feel like, increasingly, right, as the market's changing, I feel like it's trickier and trickier. And I feel as well that, I hate to say this, but not everyone is cut out to run a practice well, right? Because I think you need to be comfortable with things not going well, and like be very comfortable with it for a long time, I think, to run a practice. Because when you start, right, everything's gonna be horrible, right? Nothing's gonna you gotta like make everything up, right?
So I think what you're talking about is like understanding yourself in how you're gonna cope putting out a fire.
Well, not just putting out a fire, but being an asshole. I feel like a lot of just want to be like the nice guy, and I think the big difference when you're an associate is that you're always almost a nice guy, right? Because you don't want really to, you can't really tell someone off to a great extent, but when you're the boss, right, you got to be the asshole to everyone. You got to be an asshole to the DA sometimes, to the receptionist sometimes, to the associate sometimes, because you need them to sort of do things a certain way, and get a certain sort of outcome, right? Even if it means, just so it means that they would stay safe, right? And I feel like you need a certain personality for that, and I think you need to understand yourself. And I know so many practice owners who are stressed out as hell because they can't cope, right? Because they can't cope with the fact that they're not everyone's friend, right? And they can't cope with the fact that there's so many things that they gotta get their head around, and so they're miserable, right? So I think don't always feel like I know many associates who are doing better than owners, right? I feel like if you're an associate and you work in a great practice, easily you can earn a lot more money than an owner, and you don't have to do it, and you don't have to do any work on the weekends at night, right? Because as a practice owner, I don't know whether you talk to many practice owners, but it's at the start, right, before you hire people to do it for you, it's a 24/7 gig. There's no stopping, right? So I think you need to be okay with that. And in terms of specializing, this is something that my associates sort of talk about all the time. I've got an associate who is in her 4th year out, and she's going to do pros next year.
Yeah.
right? And I think, if that's what you do, I think you shouldn't decide very, very early that you want to do a specialty. And I think if you decide that that's what you want to do, and you've spoken to some, if you want to do endo, right, spoken to some endodontists, and you've got a good idea of what an endodontist's life is, then yeah, I think it's great. I think there is nothing better than to do something that you enjoy doing, that you get, fulfillment from for the rest of your life, and do it to the highest level. I think, but I guess, the thing about specialty training is that it is it's another long slog, right? And you have to, I know a couple of specialists actually, when you go drinking with them, they low-key tell you that they didn't think that was what it was. And they're stuck, right? So that is a problem, and I guess, my point is that when you're deciding, you need to know what you're optimizing for, right? And this is something I spoke about to the Melbourne Uni dentists, the Melbourne Uni students the other day, which is you need to know yourself. You need to know what is important to you. Because, for example, right, my wife, she is a dentist as well, with 2 kids now, and it's going to be very difficult to get her to work 5 days a week, because her priorities are just so different. Our priorities are just so different, right? So I think what you need to do is you need to figure out what is important to you. Know that everything is a trade-off, right? I mean, practice ownership, there is a trade-off. Specializing, there is a trade-off as well. Being a super GP, there is a trade-off. Even cruising, and just doing bread and butter dentistry, which is great, which a lot of people do. There are, sort of costs to that as well, opportunity costs, right? So I feel like there is nothing wrong with just doing bread and butter stuff. I think before social media, probably, that was, when you talk to a dentist 15, 20 years out, right? That was probably what everyone did. And I think that's fine. There's no stress. You earn a good living. You don't have to deal with failures. You don't have to deal with big things. The bigger your case, the bigger your stuff ups. You don't have to deal with that. And I think, that's important to you. I think if you want to have a family, if you want to have like a work-life balance, that is not a bad idea. You just need to work with that. Will do a lot of the hard work for you, so that you don't have to do the hard work yourself in terms of bringing in patients, in terms of getting people to rebook this and that.
Yeah, I think it's an interesting topic you talk about, because for the cohort and my generation of dentists, more than 50% are female. So these are very interesting topics that you talk about. Family is definitely something that they have in the back of their mind, whilst trying to achieve all the goals that they want to.
Yeah.
Yeah, so I want to move on. I want to come back to just the implant, your CPD side of things. So implants is now something that's, progressing. You've talked about you were not so much, you were doing some, modular courses, but what you got out of it was that you needed to focus on the soft tissue side of things first, the perioplastic side of things first. So talk to me about, how you kind of decided to go, what kind of courses that you wanted to pick.
Well, that was something that was given as advice, right? Like by Lincoln. And I totally agree. I mean, now that I've done the whole thing, right? Back then, I think it's still the same. There were 2 main courses that you could do. There was one course that was run by Lincoln, the soft tissue grafting course, which I did. And then, Pat Allen, which is an American periodontist, he used to fly down to Australia, and he would teach you a tunnel technique with Elegant, right? I think now there are probably a few more people that sort of teach this sort of stuff. But back then, these were the 2 courses that I did at the start. And so, started from easy, sort of free gingival grafts. My wife did a course as well, and she's probably a lot more talented at this stuff than I am. So she started, doing tunnels and having great results from it, and we sort of built from there.
Right. And then so you're doing that for perio, but that was after you did your implants. Is that what you're saying?
No, actually no, it was actually I can't remember now, so long ago. I think I did some basic implant courses.
Sure.
And I did the peroplastic courses concurrently. And I, you know, people have told me this, and I totally agree. It is much, much, much easier to do soft tissue grafts around teeth than around implants, right? Because teeth are vascular, right? So, well, I mean, they've got PDL, which is vascular around it. So that was where I started. I started grafting teeth, right? So patients with recession, patients with like poor tissue quality in the front, lower anteriors. That is where I started. And then as I got more comfortable, as I got more, I guess, you know, complex, you know, grafting or implants, that sort of stuff.
Right. And then, so yeah, tell me about how your implant journey's kind of been.
Yeah, for my implant journey, I've done, oh man, where do I start? I've done, back then, Lincoln was running an implant course with Tom Giblin, and I did that. That was modular. And then I did the whole Cambodia, place 30 implants a day sort of thing as well. That was interesting. And I did GBR, I did GBR courses, sinus lift courses with Chris Ho. With part of Guide. And then there was, you know, Rado came down to Australia, and he ran an implant course as well. And he talked about soft tissue grafting in that course. That was very helpful. And I did the hands-on implantology course with Lincoln in his practice, I think 2-3 years ago. And more recently, I did the Tony Rotondo's. He has a, I think he still runs it, a modular, you know, full mouth implantology all-in-4 sort of course. I did that. That was the latest implant course I did. And then and then you know, just refining and doing courses where I can. The last 2 years have been very interesting in terms of doing courses with, you know.
Yeah, lockdown and everything.
That's right.
Yeah. So, okay, so you basically started soft tissue, then you were doing single units, and then single units you started to do multi-units, and that's when you started to do the bigger cases. That's kind of how it's been progressing for yourself. And it's been would you say that it's been like working with patients first after each of those CPDs, and then that's how you've been slowly progressing towards it?
I mean, you know, like what I always want to do, right? And what I always tell my associates to do as well is to look for like a hands-on course, right? So, you know, I probably did a couple of implants before I didn't do any implants before I did like it was like a Trinon Cambodia course. And I was like, okay, I need to like get a feel of how everything is, right? And so you basically place implants all day long. And it is very rushed. You don't know what happens to those implants. And now people are like talking about how ethical it is, but you know, back then that was all you had, right? So I did that, placed some implants on patients freehand, and then I looked at my results, and I was like, you know what? I think it's probably better that I did it guided, right? And so I invested into technology, into equipment, into being able to plan things myself, with guides, and then sort of, I don't know. I feel like, you know, when you sort of do these things more and more, and noticing things that you didn't notice before, right? Yeah. So the more courses I did, right, the more I could bring this sort of knowledge to my cases, right, and to the courses that back to my patients. And what I did as well is I've actually flown David Atia from Sydney down to Launceston to actually watch me as I did some full arch cases. So I think, you know, that is very important, and that to me, right, just like how I flew Sui to Launceston, you know, just like how I flew Sui to Launceston to watch me take recent teeth out, I feel that it's very important for me to have some sort of feedback mechanism where I know whether I'm doing something right or whether I'm not doing something right. And I think, you know, if you ever got to get a complaint as well, right, you need to be able to show that you've had, I guess, you know, enough training, essentially.
Yeah.
Right. And for me, you know, I look at my career as something that's a long career, and I don't want to, you know, just because of something that I'm very, very keen on doing and I stuck it up, you know, and that makes me not be able to sleep at night. So I guess, you know, I think it might look like I'm very aggressive sometimes in terms of what I've learned over the years, but it's always, you know, you always have to have theoretical backing on, you know, you need to know when you're putting something in that you know why and the theoretical basis of how everything goes, how it heals, and then having some sort of practical knowledge, right? And so this is how I tell my associates to, when they're like, okay, I feel like I want to do implants, right?
Sure.
How we, I guess, bring them through as well to make sure that they've done some theory courses, they've done some practical courses. If like for wisdom teeth, for example, right? We get them to do a theory course with Sui.
Mm-hmm.
The practical courses I can sort of show them, right? Because I've done so many of this. I'm very comfortable doing it. So I think that's a good way of picking up a new skill. Yeah.
Yeah, because like you mentioned as well with the implants, a lot of the courses around in Australia are just very theoretical. Like there's not a lot of hands-on component to it, and which is why, like you mentioned, you had to go overseas to get that hands-on sensation of knowing what it feels like to do those first stages of your implants. So you mentioned, you started drift to really needing like surgical guides and all of that, which brings me to digital dentistry, which is something that's pretty big now on your end. So tell me about that kind of journey, because like you said, there wasn't a lot of CPD out there for it, but now there's kind of growing kind of education around it.
Mm-hmm. Well, I guess for me, right, it was something that I always liked to do. I think I feel like when you digitally plan a case, right? It doesn't matter whether it's a pros case, whether it's a surgical case as well. You get to see a lot of things that you wouldn't normally see, right? So there's so many cases, right, where I would put an implant on where I think, and if you can, I think I would encourage you to do this exercise, right? Put an implant in where you think it's going to be, right?
Mm-hmm.
And then put a crown in there and look at how far away you are. And this is like an ideal scenario, right, where you can scroll back and forth through the cone beam. And it's very, very rare when I do this with people that they get the implant coming out of the middle of the crown, because it's just so hard to see, right? And this is like on a cone beam, which is sort of optimized, right? Let alone in the mouth, when you're like stressing over 1,000 other things as a person placing an implant for the first time. So I guess for us, that was where I wanted things to be more accurate. I wanted to do the thinking beforehand, and I wanted to make sure that when I put the implant in and I put the crown, the hole comes out the middle of the crown, right? And
you want it more predictable.
100%. I mean, yeah, you're right. I want it to be more predictable. I want to know. That in uni, right, when I was taught implants, they always talk to you about prosthetically driven implant.
Yes.
In my head, I was like, okay, how do I guess, invest in stuff, right, such that I'm able to offer this to my patients, right? Yeah, and so that's sort of where it went, the direction that it went down, and it's worked very well. And I guess, for me, I'm also very lucky in that, I sort of entered a 3D, like I think 3D printing is a big part of this, and I entered a 3D printing space in a time where a few other guys were doing it as well. So we actually have got, there's like group chats where we would sort of exchange ideas on what's working, what's not working, what printers work. And these guys are starting to run their own courses as well, which is great, right? But it's just about finding a group of people that share the same sort of passion and is able to, that you can bounce ideas off.
Yeah. One thing I want to ask is as well, being in Tasmania, it's quite difficult to get quality CPD. I think you've mentioned, you would have to bring some of these, mentors kind of over. So how have you and, your associates tried to kind of tackle this quality CPD issue?
Well, I mean, you're right. Quality CPD in Tasmania is hard to come by, and typically you need to go to Sydney, you need to go to Melbourne. And so we sort of recognize that from a very early stage, and so that's why I think every year we try to bring 2-3 people down. This year we've only brought David down, but last year we brought Pat Catwell, we've brought Suvi down, we've brought Leo Lander down, we've brought Aniko Ball, and so these are people that we trust, that we know do a great job, and I guess you just have to choose the right practice to join, I don't know how else to say it, right? Because you're absolutely right. People don't usually come to Tasmania to run CPD courses, right?
Yeah.
And so we've had to do it ourselves, and we're very comfortable doing it.
Sure. So you've mentioned a fair few CPD. What's been a particular CPD that was a game changer for you?
Oh man, I think every CPD you do, I think actually you're right. I want to take a step back. Right? I think this is a very big misconception that I hear my associates, I hear like young dentists talk about, right? They sort of feel like they will do a CPD course and you'll be like Nirvana, right? They will like, like heavens open.
Yeah.
That doesn't happen in my experience, right? What happens in my experience is that you will get one thing. You will get one tiny little thing that changes your current workflow, right?
Yeah.
And that's going to make things better, right? So, a lot of times, right, when I've got an associate do a CPD course, I'll be like, oh, how was it? They were like, oh, it was a waste of time. And I'll be like, did you pick something out for me? They're like, yeah, I did, but it was a waste of time. So they sort of feel like, they will suddenly go from,
high on a pedestal, and now there's just like, well, it wasn't all that good.
They're just gonna take over the world. It doesn't work like that, I think that question, I haven't found a course that made me see the light, right?
Yeah.
I think that there was a course that was comprehensive, it was great. I think Tony Rotondo's mini residency really changed the way I look at stuff. But even then, there's still, they only have got 3 modules. So I think it's 3 days times 3, right? So they have 9 days with you. They can't possibly teach you how to be a prosthodontist, right? So even then, I've had to augment that with stuff that I learned from other people. I'll give you an example, right? Recently I had David down and he showed me a suture. You have to do this course to learn how to do a suture, right? But that changed the way a suture, and that gave me another tool in my toolkit, right? So for me, learning how to suture in a specific manner that I didn't know before I got him is very valuable. And so I feel like when you do CE, right, you almost have to shift your mindset from one of seeking nirvana to like, okay, what gaps can I plug, right? And be okay with not all the gaps being plugged. Because it's such a big topic, implant, for example. It's huge, right? There's no way that you can learn everything in the 2-3 days that you go for a course.
Yeah.
So,
I think that that's why we ask the question, because a lot of our community want to know what's that game changer one. So, like you said, basically it wasn't a particular one. It's been a build up of things. You get something from the little things along the way, and then what happened is you implement it at practice, and you find out, hey, these are some of the issues I'm getting with. But then it's not maybe until your next CPD that you do that you realize, oh wait, actually, maybe that's why it hasn't been so great.
That's right, and it's not just that it's not so great, but is there a better way of doing it? Is there a more efficient way of doing it? Right? Is there a way that a patient gets less pain? Gets less morbidity? After that, or you can do it quicker, right? So, these are all things that you have to think about when you are doing a CE course, and that will potentially change how you practice.
Yeah.
But actually, right, okay, if you push me, right, if you are doing CEREC module 1 run by Lawrence and Gloria, I think that's great. I get all my associates to do that. Oh man, now I'm telling my secrets, right? So and then
that's what we want. We want all the secrets. Give us all the juice.
So we get our associates to do that. I think communication, you need to do a communication course. Doesn't matter who runs it, right? They all say quite similar stuff. Mark Assad, Jesse Green. Because we're with Jesse, all our associates go through that, right? And I think when you are a new dentist, I think you should do a restorative course. You should do I think there's so many people running these now, right? Like the one run by Chris Ho and Bharat and David Atia and Johan. There's one run by Anthony Mark and the other guys as well. There's one run by Lincoln. I guess you just take a peek, right?
Yeah.
I think you need to. Someone told me that, I can't remember who, I used to hate how to do crown and bridge work in uni, right? I was like, man, if I never have to do a crown, because I hated taking impressions, right?
Yeah.
And this person told me dentistry is pros, right? So you need to, before you do anything else, right? You need to make sure that you can put the crown in at the end, or that filling in at the end, that is going to make them smile better, because the patient's not going to be like, oh, great implant you did, right? All they're going to see is your pros work. So I think above anything, right? If you wanted to choose one thing, focus on the pros first, and then everything else sort of builds around it. Endo, implants, whatever.
Sure. So what would you say to your associates, when you tell them, okay, go and do the CPD? How would you tell them to get the most out of that CPD?
I mean, I tell them the same thing as I told you. I'll be like, you're not gonna, it's not gonna change your life drastically. But what it does, right, is that because these courses, I'll talk about module 1 quickly, right? Because I teach in that with Lawrence as well. What they do, right, is that they have time to tell you the theoretical grounding of what's happening, right? And so when I tell you, hey, you got to press these buttons to get these sort of results, you know why. Also for me, right, if I were to do that, it would take so much more time. That's why I get them to sort of do that course, so that they can, Lawrence, I sort of outsource that in essence, right? Lawrence can sort of tell them about it. And this is why it's great as well that I've got that we get people down to Tasmania to teach everyone as a team, right? Because what that means is that all of us work very similarly, right? And if somebody thinks that they've got a better way of doing it, we talk about it, and if they're right, we change our way. But if we're right, they change their way, right? So I guess when Leo came down, for example, for perio, right? Essentially, what we did was we, as a group on that day, we actually discussed what our protocol was going to be, and we locked it in. So we've got like a standard protocol when it comes to perio. These sort of patients come in, what we're going to do, and how many appointments we're going to see them for, and how many appointments we're going to follow them up for, right? And that's worked very well for all the different sort of procedures as well. So yeah, so I think it's when they go for a course, I'm always like, it's not going to change your life too much, but
yeah. So who's been pivotal in your career path and why?
One person, or
I mean, you the world's your oyster. You can name 2, 3.
I think 2 people. I think Tony Rotondo. It's a pain in the bum because they're both in Queensland, so it's always like it's always a pain to get to them. But Lincoln Harris and Tony Rotondo, right? Different reasons, and I think Lincoln is he's sort of been in the education sphere for a long time, and I feel like without him almost leading the way, a lot of the CE that you see today wouldn't exist, right? I know sometimes he gets a bit trashed, but really he has really shaped how I practice, and I feel like there is always this no nonsense, no bullshit sort of vibe to him, right, when he gives advice, especially after a couple of drinks, right? So Lincoln, and the second one, Tony, is just it's amazing work, right? And one thing, right, actually, when talking about CE, I want to share this story.
Sure.
So I've actually watched Tony in his practice a couple of times. Yeah. And there was one time I was watching him do composite veneers that he's so famous for, right? And he uses like, when you do his course, you will learn, right? He uses like the most ghetto sort of, I don't know how else to describe it. He uses the most ghetto equipment, right? Like a Maya strip and a wooden wedge. And I'm like, is that it? And he's like, yeah, that's it, right? And so I asked him, I was like, okay, so I use a Maya strip as well. I use a wooden wedge as well, but what the hell? What's going on? Why the disconnect? And he told me, right, he was like, man, I've had 20 years to work on this. And I think that is a great point that I always share with my, not just my associates, right, any younger dentists, right, is that your hands take time to connect with your brain. I don't know whether you've how long have you been working as a dentist?
Myself, this is my 4th year now.
Yeah, so 4th year, right? I think you can start to see it, right? There are things that you would never be able to nail when you were a new graduate that you do without thinking now. Like sectioning a tooth, right? Like a great one that I see a lot of associates struggle with is actually something simple like opening that clamp of a rubber dam and making sure that the rubber dam sits underneath the clamp nicely, right?
Yeah.
New graduates just bung it up, but that's because it's not their fault. It's because their hands haven't learned how to do it. Whereas someone like myself, someone like Tony, right? He will do it with his eyes closed, you know? So I think you need to give your hands time. I think that's the point I always tell them, right? You need to give your hands time to build that muscle memory so that when you tell your hands to do something, they actually do it. Because it takes some time to actually build that memory up so that your hands listen to your brain. Because I'm sure there'll be so many times where you look at something online, you're like, yeah, that's easy, right? And then you do it, and you're like, totally not what you thought it was going to be. So yeah, I mean that was a great experience when I went to Tony's practice and I looked at him do magic, and he does it so quick as well. It's not just a mylar strip and a wooden wedge, but he does it in 25 minutes sometimes, right? A diastema closure, and it will take me ages to build that cervical and slowly sort of make my way up. And you just got to be comfortable with that it's a journey, it's not a. And so just like how you told me, you asked me then, right? Is there a holy grail course that everyone should do? Right? It is a journey, and you have to look at it like that. And so I feel like there are a lot of disillusioned, I think it comes in the third year as a dentist, where you are like, oh my God, what am I doing with my life? And I think that's where a lot of these, should I become an owner? Should I become a super GP conversation come about? Because they just are like, at 3 years, I should be doing magic, but I'm not doing magic yet. And I guess, to your listeners, what I would say is that you shouldn't be doing magic at 3 years. It doesn't work like that, right? You need to give it time.
Yeah, I mean, Tony's pretty big on, he said in a previous podcast as well about, you can't do if you can't, I think it was either see it or,
Yes. And I think that's it as well. As a younger dentist, right, you haven't really seen it enough. And I think, yes, you need to learn how to see it, but just seeing it is not enough. I feel like, your hands need to follow your brain. And I don't think that always happens until you learn how to finesse it. It's like, surgery, right? It's like splitting a flap, right? It's like, splitting a flap and advancing it properly, right? Like when I did it 3 years ago, it was messy, right? It was like blood everywhere. But now when I do it, right, it's just very little blood. And I think, it comes down to the fact that I've used my hands doing that sort of things a lot more, and I've had time, to get better at it.
Yeah. Some people want to know, have your parents been a pivotal reason why you went into business so early? Because they've been known to in manufacturing, right? I mean, your whole family have been in manufacturing.
Man, where do you dig all this stuff from? Wow.
You're Bing-wei Lee. I gotta know these things.
Okay. Yes. Well, yes and no. I think, my parents are in business. It's funny because when I told my parents that I was going to be a dentist, they were like, "What? Why are you going to be a dentist? Like, you're just going to be stuck, as long as you're not working, you're not making money, right?" So it's a very, very different mindset. And yes, I think on that note, yes, 100%, that has influenced me in terms of how I think about stuff and how I, and the decision to sort of go into practice ownership earlier. But in saying that, right, I think they're right. At that stage, I was like, nah, bullshit, right? But they're right because I'm heading to work on Monday and working as a dentist. That's right. But I'm just lucky that I like it as well.
Tell me about mentoring, and because you're pretty big on culture, like you've mentioned already. So mentors, what's the key things that graduates should look for in a good mentoring program?
I think you should look for 3 things. I feel like you should look for a mentoring program that has got the flexibility to deal with things that can come out on a day-to-day basis, right? So things that would mess up, right? Things that, if you can't take a tooth out and you're stuck, who's going to help you? I think that's important. I feel like, it should a good mentoring program should have structured bits and non-structured bits, right? I feel like the non-structured bits will be the day-to-day. You can't predict what's going to happen today, and someone builds you out. And then, it has to be structured as well, in the sense that, if you can, you need to have somebody to show you how, if you want to be a certain sort of dentist, like what steps you need to take to get there, right? And something in between where, if you've got a case that there are provisions within that to help you to communicate to patients, to basically, stage out a case, like what do you do first, what do you do next. So I think it has to be a mix of structured and unstructured time. And I think above all, right, you need to make sure that you've got a time and space, or the mentoring program provides you with the time and space in order for you to, in order for you to grow as a clinician, because you're not going to be on the same level as somebody in your third, fourth year out. You're going to think so, but it's not going to happen. And you would know this, right, for somebody like in the third, fourth year as well.
Yeah, of course, yeah. I mean, you've mentioned before that there's the same 5 things new graduates always struggle with. Are those some of those things of the 5?
Yes, I mean, the 5 things, right, would be stuff like learning how to section teeth, all right, because a lot of people won't have any experience in uni, right? Learning how to section teeth, learning how to find canals, learning how to get down MB2s, learning how to communicate to patients, how to talk to them about, especially if you went to a uni where you work in a public clinic or you work under a public system, it's very, very difficult for you to suddenly tell someone that they need to spend $2,000, right? And on a crown, right? And there's 3, and then you need to make sure that you are able to, if you're doing CEREC dentistry, there is a massive learning curve, right? If you haven't used a CEREC before, to getting good, predictable, results with CEREC, I think that our new graduates, even recent graduates, right, struggle with. And the last one is securing deep margins. Like how do you, make sure that when you put, when you've got a filling that is very, very deep, how do you make sure that when you take an X-ray, it's sealed and it's flat? So these are the 5 things that we work on from day one, and we focus on these things essentially in the first 6 to 8 months of someone being with us. We work on this all the time.
Fair enough. Share with us what you hope your ideal clinical or non-clinical day might look like in 5 years' time, and what kind of CPD do you want to do to kind of get to that point?
I mean, for me, ideally, right, I would like to do more reconstructive stuff, like more sort of, building teeth up and putting jaws where they should be. Implant work is very big. And I guess, what I want to do, right, is probably integrating different disciplines, integrating different sort of, doing a bit of ortho and then do a bit of perio and do a bit of endo if I have to, and doing them well to get to a good result. So I think in terms of CE, what I need to do to get there, probably, getting back to ortho again, more implant, bigger grafts and learning how to get predictable results, out of that.
So maybe some like overseas courses or something that you're thinking about.
Yeah, probably, and also local courses as well. I mean, now there's so many people running these courses locally, right? And I think for us moving forward, it's probably going to be more bespoke, where we get people down, sort of courses where we go through that.
Yeah, because you found that it works better for you. Yeah.
Well, it works better for us, and because it's essentially tailored to where we're like. And now that we've got a bigger practice, right, we can afford to fly someone down, because that's the expensive bit, right? Flying someone down, putting them up, and I think if you had a smaller practice, that would be more tricky.
Yeah. So make it beneficial for both you and the mentor per se. Well, Dr. Bing-wei Lee, thank you for coming on the show today. If you could let the people know how they can find you or what you kind of got going on in your life.
Well, I mean, I post stuff on Facebook, and we've got an Instagram account as well, Launceston Dentist, and we are looking for dentists for our 2021 intake as well. So 2021, 2022. So if you think you're a great candidate, do put in your applications, and we'll be looking forward to that.
Awesome. So for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you on the next episode of CPD Junkie Podcast. Thank you.
Thank you.